Okay, people are still streaming in, but I'm going to begin slowly and warm you up by introducing today's speaker. So welcome to this week's CIF seminar, which is about proximity tracing with Coronalert and about, in particular, the lessons learned about working through this exercise. It's my great pleasure and honor to introduce Professor Bart Preneel, who has been in charge of getting Coronalert working in Belgium. He is a full professor at the KU Leuven at the Department of Electrical Engineering, where he heads the COSIC research group. His main research interests are in cryptography, in information security, and in privacy. He has served as president of the ISCR, that is the International Association for Cryptologic Research, and it's the largest international association of cryptologists. So it's basically the one association that we really have. He is active in ELSEC, which is a Belgian cybersecurity coalition. He's active in the European Network Information Security Agency, ENISA. Also active in the Belgian Data Protection Authority. He's co-founder or otherwise involved in NextAuth and NIM technologies. About 5 years ago, he received the RSA Award for Excellence in the field of mathematics. And a little bit later, he was also elected as a fellow of the ISCR. He frequently consults for industry and government about security and privacy technologies. And of course, very relevant for this talk, and that's why we selected him, is that he is a team member of the DP3T team, and he is the technical lead for the Belgian Coronalert app. Bart, the floor is yours.
Thank you, Benedict, for the introduction, and thank you all for joining. I hope to entertain you a bit during this lunch with the lessons I learned from proximity tracing. This talk will be a mix of broader context, a bit of history, but of course it was a very intense and roller coaster ride. It still isn't over yet. So we'll try to reflect a bit on what has happened and maybe also look at the lessons learned and maybe what we can learn for the future from this. So I'll first take a bigger picture, look at big data and Corona, then we'll switch to digital proximity tracing. We go a bit more in technical details, although for those of you who want to really know the fine details of the protocols, I will have to disappoint you. I will not have enough time to do that, but we'll look at evaluation next. So I guess this pandemic hit us about a year ago, and of course, technologists were wondering, what can we do to actually help with technology? How can we make it a better experience? How can we better fight the pandemic than in the last pandemics by using technology, and in particular, the smartphones we have in our pockets? So of course, we can use it to spread information, although we've also seen that these things are used to spread disinformation. There were quickly quite some tools for self-diagnosis. Some people had the idea to collect medical data. The thing which I found the more crazy was this idea to analyze the cough of people with a mobile app, and apparently it seems that this kind of works to decide whether or not you actually have corona. But I haven't seen it used on a large scale. And then the topic of today, can we actually use location to find out where people got infected and maybe to control the pandemic and to identify new cases? So Europe was a bit slow in this. Of course, the virus first hit in Asia. In Asia, they had experience with the SARS earlier on, and they got actually warned. And so about a year ago in South Korea, out of the top 10 apps in the Google Play Store, there were 5 coronavirus related. And in China, which we see from here as a big monolithic block, it turns out there were more than 300 apps related to corona. They were very much often based on cities or regions, and everybody had their own solutions. If you look here on the right, what you see is in Korea was a pretty effective approach. What they did was, as soon as somebody came positive, they published all their locations. They also went to look at their credit card data, video camera surveillance. They published all the locations of this person without their name. Of course, I shouldn't tell you that. Then, of course, it became pretty easy to identify who it was. If you find out where somebody leaves the house in the morning, then he goes to maybe have a coffee. He goes to his office, picks up his children from school. So this is an approach which obviously would not be acceptable in Europe, but in Asia seems to have been successful to some extent. What you can do, so it seems that this conversion big blue button has messed up some of my slides, but it's not too bad. So of course you can use location in many ways. Something which has been done is cell phone surveillance. Of course, your phone knows where you are, and also the operator knows where you are. And this can be done in general to measure densities, measure how many people go to the office, how much traffic there is, how crowded parks are. Of course, you can also use it for surveillance. At some moment, we had rules that you, for example, in France, you couldn't leave your house or you couldn't move away from your house more than 1 kilometer. And in principle, you could use cell phone surveillance to detect this. This was in France even for people who were not infected. In Italy, we also had very strict rules. So it's not maybe a very nice way of using technology. It's very invasive and very much on the policing side. So you could, of course, detect where crowds are. This has been deployed by Google, also has been used, I know, in Belgium. So the government used this to detect social interactions and how many people were still going to the office or whether there were not too many crowded locations. Today, you could actually find it out, for example, to find out whether the shopping street is very busy or whether a certain market is very busy. If you work with aggregated data, it's not so privacy invasive and probably acceptable. It can use GPS data, which Google does to locate people. Or of course, it can also use phone data. You can make a combination of both. Today, we'll speak about proximity tracing. So it turns out that this virus travels mostly to contact, but in fact also to aerosols, to people breathing out particles that others inhale. And this is how we get infected. So the idea is, can we use technology like GPS or Bluetooth to find out who has been near to us? And so if there is somebody got infected, to actually warn the others that they may be at risk of infection. And this is called contact tracing if you do it manually. If you do it with a smartphone, we call it proximity tracing. So I guess after 1 year in the pandemic, I can be very quick about this slide. One of the challenges, particularly of COVID-19, of this virus, is that you actually become infectious before you have symptoms. And this means that it's not sufficient to just put people in quarantine who have symptoms, who have a positive test. The problem is, if you really want to stop the pandemic or reduce the number of infections, you have to identify people as soon as, of course, a positive test or with symptoms, then you have to identify all their contacts. And those contacts should quarantine as soon as possible. So somebody with a positive test or symptoms has to isolate, which is stricter. But the contacts of this person in the past days, they actually have to go in quarantine, which also means they should, of course, limit their interactions. And this is essential. So it's essential to identify those people as quickly as possible, and those people actually stick to the rules. So epidemiologists tell us that these kind of what they call non-pharmaceutical interventions are essential to control an epidemic. And of course, it only works if you have sufficient testing capability, because otherwise you can't identify positive cases. The whole system has to have sufficient capacity also for contact tracing, and society has to support it. If people who start coughing or have symptoms refuse to take a test, or people who are told to isolate or quarantine ignore it, well, then in fact you will not be successful, no matter how effective your contact tracing or proximity tracing is. So historically, we only had manual contact tracing, which means people went door to door, or later on people got called and asked them about their contacts. Of course, it's kind of privacy invasive, so people may not be willing to tell strangers or to tell somebody else who their contacts were. In particular, this is a concern if there is tight restrictions on contacts, because then you more or less have to admit to this contact that you've broken the rules, which may risk you a fine. Typically, it's very slow, in particular if the incidence is high. And then contact tracing can no longer catch up, and you see that in fact it takes days before people are being contacted. And of course, you can only identify contacts that people are willing to say that they actually remember. So if you sit next to somebody on a bus, well, you probably don't know the name of this person, and you can't mention this. So very early on, the idea was there to actually use apps to find out where you had who was close to you, and South Korea was an extreme example of such an app. Also, China had these kind of apps. What we set out to do was make an app with privacy by design, which would only collect minimal data and still identify contacts. Ideally, it should be faster, which means within less than 24 hours, you should be able to identify your contacts. And hopefully, it should be more accurate, or accurate enough that actually you don't have false positives and negatives, or not too many. And so it also works with strangers. So I think very early on, there was this myth that we're going to replace manual contact tracing by an app. In practice, both are complementary. It's clear that some people don't have a smartphone, some people don't have the app. But even if everybody had a smartphone, everybody had an app, you still would like to combine both things. And I think that what we have learned as a lesson after a year is that if there is sufficient uptake of the app, and we'll come back to that, then actually app can help you to make manual contact tracing more efficient and can help you to control the pandemic. I think that's a lesson. The main lesson we learned is it kind of works. It definitely does not replace everything, and I don't think that I was one of the people who ever advocated this. I think it was clear from day one this would only have a modest impact, but some impact, but it does actually help to some extent. Very interesting. That was not what was on my slide, but more or less, I can tell you what was on this slide. Oh, here it is, that's better. So the first idea, of course, if you want to identify contacts, at least for non-experts, is let's use GPS, because GPS is pretty accurate. It works with an accuracy of a few meters. And the military variant works even more accurately, but of course, civilians don't have access to this. And so South Korea, Israel, Singapore, Norway, actually all tried solutions with location data. There is several problems with this. The first problem is a privacy problem. Once you have somebody's location at 4 points in time, more or less this person becomes unique. So you can no longer argue you can do this anonymously. Even if you say, well, like South Korea or Israel, we don't care too much about privacy. Even then, what we found out during the course of this pandemic is that a lot of infections happen inside. It turns out that GPS does not work very well inside. And also the accuracy is kind of limited. So it's a few meters, but if you have two phones with each an accuracy of a few meters, it's not clear whether you can find out whether people actually were within 1.5 meters or 2 meters or actually 4 meters. So there is accuracy problems, in particular inside, and there is major privacy problems. The other problem is that indeed, we as researchers, we were concerned about privacy, and so we predicted that once you start creating large databases with all the contact information, with as motivation the pandemic and proximity tracing, actually law enforcement and intelligence services would get access to this. And more or less, this was a prediction made, and indeed, we've seen this as well. So for example, here you see an article, intelligence police getting access in the UK. There's more cases in Australia. Spy agencies were involved. In Singapore, the police also got the data. And then you got a system where you had to register in bars. And of course, barmen then used this to find out models in the bar, and they get their phone number and they started contacting them. So more or less what we predicted actually happened, unfortunately. And if you don't take care of privacy, the system will be abused, which also means actually that people will also be reluctant to use it. So that's kind of, people will try to avoid the system. And in fact, avoiding a system based on a smartphone is not so difficult. You just leave your smartphone home, or you have two smartphones, or you buy a metal box, or you switch your smartphone off, and so on. So there is many ways to avoid this. So you actually have to assure people that you will not abuse this tool for privacy violations, for policing, for intelligence. I think it's very important to get an uptake, in particular in Europe, where we have very strong privacy protections and experiences. So in Norway, this is closest to home. Actually, Norway had an app based on location, and their privacy authority actually forced them to pull the app and just remove it from the App Store. More recently, they now implemented the Danish app. So this pulling happened in June. It took them then 6 months to recover. They now implemented the Danish app, and I think this week or next week they will join the European system. So the goal we had was to actually work on privacy by design. The question is, can we actually do contact tracing or proximity tracing without creating a large database, without giving the government access to the social graph or the social count, which means who are your contacts and how many contacts have you seen? So we wanted to use the data only detecting proximity, and for this reason we decided to go for Bluetooth as a pragmatic solution. Bluetooth is not perfect, but it's present in most phones today. And actually it allows to detect whether two devices are nearby. We'll come back to how it's done exactly. And so we want to do this while protecting identity. So we don't want to find out in a central service who is in contact with whom, where, and when. So we only want to find out you have a risk contact, a high risk contact, which is defined by the WHO as 1.5 meters, more than 15 minutes. Although there is now talk, of course, to adjusting this based on the variants. It could maybe 10 minutes or 5 minutes. And also very important that if somebody is not infected, you should not find out any information about them. So it's only infected people. Unfortunately, if you want to learn from their contacts, you have to share some information. Otherwise, you can never find out who was nearby. But you want to minimize this information as much as possible. Because, of course, your attention with the medical people, the epidemiologists, they say, well, we want to know whether this contact was in a supermarket. We want to know who else was there. We want to know, they want to have more details. But I think our argument is, if you're going to do this, you will only get a very small uptake because people will be worried about the abuse of the data. And so also the system should be in such a way that it actually disappears automatically once the pandemic is over, that it's kind of easy to shut down. Other requirements, it should be sufficiently accurate. So of course, it's not if you cross somebody in the street, you should not get a warning. Of course, there are problems. We can come back to that. For example, if you live in apartment buildings with a thin wooden floor, like for example in Leuven in the Beginage with Eindhoven, well, you may actually get a warning from your upstairs neighbor. That's kind of unavoidable if you use technology. You can't make it perfect, but at least you want to make it as good as possible. We'll come back to this. What you also want to avoid is people can do false reportings. So you don't want self-reporting system that was considered in a few countries. But you also don't want, in principle, you want to avoid that somebody can get the right to report the infected when in fact they're not infected. And in Belgium, we were kind of worried about this, so we added quite some protections against this, although we do pay a price for this in some people not uploading, although they could upload. Other requirements was that it should scale quickly. We want full transparency. We didn't get full transparency, but at least the specifications are open. Most of the software is open. We'll come back to that. As I mentioned already a few times, you wanted the system to be voluntary and also deployable quickly. As you saw in Asia, people could do it very quickly. The government rolled out these systems in a matter of weeks. As you will see, in spite of this requirement, it took in Europe a matter of months still to roll it out. But still, we wanted to do it pretty fast. In the end, if you look at all the decisions, it turns out you actually cannot do this at a large scale with Bluetooth technology without having collaboration of Google and Apple. So first, you have to have a compatible version with Android and iOS. It turns out that, of course, they use Bluetooth standards, but for example, iOS phones, for example, have a much higher transmit power, so you have to take all these things into account. It wouldn't work if those phones had different protocols. A very important constraint, which people experienced and still experiencing in Singapore and France, is, of course, you don't want this app to be a battery waster. If people find out that once they use the app, their battery dies after 4 hours, they will quickly block it or uninstall it. So you actually want to optimize the use, and it turns out that, of course, unfortunately, Google and Apple have very good control of this. They're the ones best placed to manage the pattern. And in case you have questions about this, there's people still complaining, in particular on Android, about battery usage. The problem is that on Android, until version 10, you have to activate location services for the app to work, although you don't use location in the app, very interestingly, you only use Bluetooth. And of course, then other apps start using more power, and so people actually have a problem with power, not because of the Coronalert apps or the proximity tracing apps, because of other apps that suddenly start using the location. So on iOS, there is also a very big problem that you can't use Bluetooth in background. So more or less, if you want the app to be effective, you have to run the app in foreground, which is again a problem for battery usage, also for privacy. If you lose your phone, then it's running in foreground with an app. You actually don't have any protections. We also want the support for all the devices. Maybe the latest good news is that the version for iOS 12.5, so the famous iPhone 6, got added in December. And for example, in Belgium, Germany, and so on, in the last few weeks, finally, those phones also got supported. So a price paid for this, of course, is that now Google and Apple decide the protocol. Luckily, there were quite some intensive contact between w.r.t consortium and Google and Apple, and there were some arguments and debates about some choices. But in the end, of course, they make decisions. And for example, also they decided to not reveal all their code, which we still regret, and we still insist on having a full audit on this. But so there were quite some trade-offs to be made in terms of battery, CPU, and the protocol. And I would say, as researchers, we're kind of happy with the privacy features, but we still think from a epidemiology point of view, we would have sometimes made different trade-offs, and we're still asking them to do this also in terms of transparency. I think we made a big step forward. Again, we didn't get fully what we wanted. And maybe more surprising even is that Apple got very frustrated at the low uptake of these applications, and also Google in the US. So in the end, they did something they promised they would not do. In the end, in September, they actually rolled out their own app, which is actually not usable or not activated in Europe. So more or less, Google and Apple did also some good things. They were very worried that this functionality would be abused by other services, by governments to track people and so on. So they actually keep very tight controls on who can use this special API. So only one app per country or per region can use this API, and this app or country can not use location services. So more or less, it's very interesting that now, I mean, usually Google and Apple are more, particularly Google are in conflict sometimes with governments and users with respect to privacy. In this case, actually, Google and Apple definitely chose the side of the user versus the government. And this is also the reason why, for example, in France, you can't support this API. And in France, there is still an issue of running the French app, which can't use the Google Apple functionality on iPhones. So it's a very interesting political debate. And so suddenly you find yourself sometimes at the side of partners with sometimes your opponents. So in that sense, I think it was a very interesting political discussion. I will not say too much about the history, but so our consortium got together in March 2020, so rather soon. Very important to note was that there were also lawyers in there, epidemiologists. We probably could have used even more social scientists, but we did try to involve the broader community. And there were, of course, also a lot of privacy experts, communication experts, and there were very early on talks with Google and Apple. Google and Apple finished their protocol in April, which is largely based on the DP2T protocol. By the way, in the US, there were also two similar initiatives called POD-PACT that also had some influence. And the protocol and code were finished in May. And the first apps launched in Switzerland and Germany in June. And at that moment, also, Europe started working on the probability at EU scale. The Belgian app launched in September, so we were a bit later because of some political problems. And the European server launched in October. And at this moment, I think there is 12 countries connected. We'll come back to this. In the meantime, and with some delay, the app also rolled out in South America, in Asia, in a limited number of countries. In the US, there is now 25 states and territories, but from what I hear is that the pickup is very low there. So a bit about the Belgian timeline. March, April, and May were very chaotic. There was lots of debates, and there were many companies announcing they had a working app and they had a solution, and the government should use their solution. Then, as a response, some people in the government didn't want an app anymore. And then there was also a debate which level should organize the app. So Belgium tends to be a very complex country, and in fact, all decisions with respect to the app are taken by the Inter-Ministerial Conference. So Belgium has 8.5 ministers involved with health, and they all have to agree before anything can happen. So this meant there was lots of discussion, and then end of May, it was decided to finally go ahead anyway. So I think already in April, it was clear that if we would roll out anything, it would be a DP2T privacy solution and not many of the proposed solutions with location data. So, but then there was kind of a period of uncertainty. Then I was asked to lead an ad hoc working group end of May to actually prepare the launch. We made a document end of June. And then in a very short time, we complied with all the complex government procedures. Of course, we have to prepare a call for a tender, which had to be sent to 20 companies. Then you have to evaluate the answers received. So everything happened in less than a month. And the project kicked off. And so more or less, in 7 to 8 weeks, we managed to get the app up and running. The code was largely based on the German Coronalert app, but we did make quite some changes because our healthcare infrastructure works slightly differently. And so we wanted everybody to get a test result in the app. And we also wanted to link the app to the test at the moment when you apply for the test, and not like in most countries when you have a positive result. In parallel, there was a public consultation. And so the launch happened in September, first slowly with 90 users, 10,000 users, and then the full rollout happened end of September. And then after 3 months, beginning of January, we managed to connect to the European server. I'll come back to that later. So all in all, there were some very hectic periods, especially in the spring, when the debates were more political, who should decide about this? What does each government want? Who's going to pay for this? And then, of course, once things got launched, it got very hectic because of legal procedures and then finally development procedures. Compared to other countries, our budget is very modest. The German budget, including communication costs, is estimated between 50 and 100 million euros. And the Dutch budget is between 4 and 5 million euros. The Belgian budget is definitely below 2 million euros, maybe it was 1.5 or 1 million euro. It depends what you count and how much advertising costs you take into account. But so it was a low-cost effort, which of course meant, and also very condensed, which meant people had to work very hard. It was a big challenge for that reason. There was a big emphasis on transparency because already early on there was a demand actually from academics that we should be more transparent about this, and rightly so. I think some academics got worried about some of the apps being proposed being highly privacy invasive. So there was quite some pressure to be transparent, and so I think we're still doing quite well on this. So all the documents with the app, with respect to the app, also legal documents, technical documents, the code are public. I think there is still one working point. The ethical committee still has not been fully installed, and it's something I'm still working on to monitor the operation of the app. But there is, of course, quite some monitoring happening at the level of the ministers, at the level of the technical experts. And there's also many parliamentary questions being asked. So how does the protocol work? I have a few slides without animation. It's a bit tricky, but the protocol is actually very simple. So in your phone, you install the app, and the app just broadcasts Bluetooth beacons, so random signals. There is many cool protocols being proposed already early on that actually establish connections between phones, that use Diffie-Hellman exchanges, that use pairings. It's all very cool cryptography. The bottom line is, in practice, it's not going to work. If you, for example, get on a bus and there is 20 people on the bus with the app, it will be impossible in Bluetooth to establish 20 connections and do exchanges with those phones. This is just Bluetooth, and the phones are not designed for these kind of things. So there is better technologies like ultra-wideband. It's available in the very high-end phones. Again, it was not possible to say, oh, let's just use an ultra-wideband device and start rolling this out. I think technically it was feasible, would have required a very big alignment. I know there were some efforts in this direction, but I think the cost would have been much higher, and I think the delay, I don't think we could have gotten anything operational before September, October. Definitely would have lost, at the European scale, at least 3, 4, 5 months. So there are already quite some deployments active in June and July. So in that sense, I think it was not a feasible alternative. So the Bluetooth solution is available on every phone, and we decided to use that one. So the phone just sends beacons, not very frequently. I think only for a few seconds every 5 minutes. And the phone also listens for beacons every 100 or 200 milliseconds. So it's the other way around. So you send 200 milliseconds, you send beacons, and you listen for a few seconds every 5 minutes. So these beacons are randomized. They're generated, as we will see later, by a key, but more or less they're random strings. They contain some encrypted information about the signal strength and about the phone type, so that because every phone actually has different transmission levels, so you have to know some data about the phone, not the unique model number or the phone number of the person, but some data about the phone to be able to use the signal strength to estimate the distance. And so this is actually being encrypted. So it's only when somebody gets infected that you get the information to decrypt this information. So the phone wakes up once in a while and just listens to Bluetooth beacons and stores those in some memory. Access to this memory is limited. So this is actually controlled by this famous Google Apple API. So it's not so easy as a user. It's limited how many times you can read this API, and you can't just get all the data. This is for privacy reasons. So you would have to do quite some hacks to get all this data. In general, it's kind of protected or restricted how you have access to this. So if somebody gets symptoms or somehow gets tested for whatever reason, then he visits a doctor. There is a complex infrastructure behind this. And then the test result in Belgium ends up in the app. It happens within typically 12 to 24 hours. So the result being available, there is some constraints why we can't do this immediately, because, for example, it turns out that the lab doesn't send all the test results too quickly to the central database. Then again takes some time to send it to the user. I can go into details offline. It would be talk by itself how this protocol works exactly. It's a polling protocol. If your test is positive, then you're requested whether you want to share your data, which means that the codes you've been sending out, you will put in a central database. And on iOS 4 times per day, on Android once a day, all the apps download these codes and they check whether they have received this code, and then they start doing calculations with extra information, whether they were actually close by and whether this contact was long enough. This is a very complex calculation, which is optimized to actually minimize number of false positives and false negatives. And so if your phone locally decides that indeed you were too long, too close to an infected person, then you will actually get a red screen. You will be warned of a high-risk contact. And then you're requested at this moment to get a test, and of course also to quarantine yourself in the meantime. So this is how people get warned. So the essence of the system is that the central database actually only has random codes produced by positive users. So it doesn't have any personal data. It doesn't have phone numbers. The system doesn't have your phone number. It doesn't have names. People don't find out when they got infected or where or by whom. They just know that they had a high-risk contact. In Belgium, it turns out you also get information about low-risk contacts. For example, when I was lecturing in October, there was quite a distance between me and the students, but it was a large group, so it was kind of, because it was a second wave, kind of very likely some students would be infected, but so I only got low-risk warnings. So that actually is an indication that the app works. And also, it actually shows you, well, there is indeed a pandemic and there is a problem, so please be careful and keep the distance when you're teaching. So in that sense, it has also a psychological advantage that you know the app works and you get warnings from that. So, but the essence is that the central database has no information. The government only sees data from infected people, but it doesn't know who it is. And it doesn't have any information except from this is information from this particular date, but it doesn't know locations. It doesn't know exact timings. And so again, users are warned, but they also get very little information. They could deduce on which day it was, but that's everything. So they couldn't find out what the hour was or what the time was. The next slide shows in a bit more detail. So of course, you're not gonna upload all your codes because that would be too much. So you actually generate per day a key. And with this key, you generate codes. The broadcasting is the same as on the previous slide. And of course, what you will upload, if you're positive, is your key. And so every day, you actually, all the phones will upload or download, sorry, all the temporary exposure keys of infected people. And based on this, they will make a high-risk calculation. So this is optimally privacy preserving because the central system doesn't know about contacts. It only gets some random information from infected users, but all the calculations about risks and happen on your phone locally, and the answer there is low risk contact, high risk contact, or no risk. So it's a very limited information you get, and the central services have no information. Because of course the price to be paid for this is that you don't know everything, you don't know how well the app works in some sense, or if you can only indirectly deduce it, because in fact you don't know how many people get warned. This is something like every week in Parliament there's questions, how many people have been warned by the app? Well, we don't know. Right? Of course, indirectly, we can give you some numbers, but if you want to know the exact number, we don't know. How many people have their app on? Well, we don't know. We know how many people downloaded the app. We don't know how many installed it, or we don't know how many are actually still using it. Again, there is indirect ways we can deduce it. And I'm skipping here many details because there is some very fine points. For example, when you upload keys, as happening here, somebody could monitor this channel and see if this person is uploading keys, so he or she must be infected. Well, of course, what we do is that every phone uploads keys on a regular basis, so there is quite some dummy traffic to hide actually who's uploading keys and to hide who's getting tested and so on. The system is not perfect, but there's quite some effort being done, spent on the details, and it's very tricky to implement in practice with dummy traffic so that you actually, by observing the system, can find out minimal information on it. So if you have low risk, you get a green screen. If you have high risk, you get specific instructions with and without symptoms, what you have to do. At this moment, everybody with a high risk can get tested because the test capacity in Belgium is now 100,000 per day. and we only use about half of that. So it's not a problem at this moment to get tested. So at this moment, in the EU, there is 67 million downloads of DP3T apps. The number of active users is harder to estimate, but we think it's about half of that. So we can find out, because some countries do telemetry, and for example, in Belgium, we can do analysis of dummy information, find out how many apps are sending data. In the UK, they have about 20 million users. UK and Wales are not included in this list. The download rate with respect to population, you see here the countries which are the darkest. The highest download rate are Finland and Ireland. Belgium is around 20%, is intermediate. So Germany, Denmark, Netherlands are between 25 and 30%. So some countries only get a few percent. The countries in green, this is France and Hungary, they actually use a centralized system. If I have time at the end, I will explain that too. Potentially the government has much more information. It makes it easier to fine-tune decisions. But of course, it also means it's more privacy invasive. And it also means de facto that it's highly unlikely that countries will be willing to share this kind of information with each other, because it would actually be quite some sensitive information about your citizens. So I think that's a big problem. It's national systems. And so those Belgians living close to France, they actually have as only option to have 2 apps and then hope that they don't interfere badly with each other. And of course, give up your privacy to the French government. So the only information that you share with the central database are these keys. And so these keys, although the privacy lawyers have said these keys are personal data because they're pseudonymous data, because in principle, if you do a lot of effort, you place antennas around somebody's house, or you follow somebody, you could actually, if this person becomes positive, you could, in principle, make a link between a person and a key. Of course, in practice, it's pretty hard to do. And of course, in practice, if you follow somebody or you place sensors around somebody's house, you can find out a lot of information about this person as well. But that doesn't matter. So this data is seen as pseudonymous data, but it's shared between countries. So it's not highly sensitive data, actually, although it's pseudonymous health data. So it's seen that the privacy risk is acceptable. So actually, a European server was built. The design was made in June. The server went live in October, where all the countries share all their keys. And at this moment, we work in a one world model, which means that all the countries share all the keys with everybody, which means that, for example, in Belgium, since the beginning of January, instead of using an app with 2.5 million downloads, we now use an app with 65 million downloads, which means your app gets many more keys because we don't keep, or we don't tell the user from which country a key is. There would be ways to solve this, but it was decided to, at this moment, some large countries decided not to implement this. And of course, if the large countries don't want to give you information, then it makes no sense for the small countries to do it either, because the impact on performance would be limited anyways. So at this moment, there is 13 countries connected, the ones in green here, and there is 5 more planning to connect. Greece, Cyprus, and I think Slovakia are still planning to still rolling out an app or planning to roll out an app, the ones in yellow. So as I mentioned, France and Hungary are the exceptions. I'll skip the details, but in practice, a lot of work was spent already starting in April in making a specific protocol, and I will not go into detail. This protocol has been redesigned many times, and then once it was deployed, it turns out that there was quite some problem with the medical doctors, or at least with some test centers. And so we had to redesign part of the protocol and add some other options. So overall, it's a pretty tricky protocol, but the main advantage it has is that there is a complete separation, or almost complete separation, between the database of Sensano, which has, of course, test results and all the health data, and the app. So these two are separate worlds, and there is separate databases for this. There is also protection of IP addresses. There is dummy traffic. And so there's a lot of work being done to actually make this protocol anonymous, in the sense that the government has no information about what's happening on your app or which information you get. And so this is, I think, where a lot of the effort was. So in other countries, if you test positive, you actually have to call a number, and then you get a code of 6 or 8 digits, and you type this code in the app, and that's your authorization to upload your keys. Of course, nothing stops you from taking another app and entering this code in that app. So in Belgium, this is not possible because the authorization mechanism that's used here is actually linked to the test code, but in such a way it's using a commitment. So in fact, the government cannot make the link itself. So there is kind of a commitment you make, but there is a link made just between the test being applied for and authorization being received. So you cannot upload as a user authorization code or the keys of somebody else. So there is a tight protection being made in a privacy-friendly way by using a simple commitment protocol. Now for the final part, evaluation. Everywhere you come, and this is something that unfortunately happened in April. So in April, Oxford University published a study which was actually misquoted, and I think it's the only thing politicians remembered for a very long time, which was 60%. So apparently somewhere in the study, it said that you need 60% adoption of this app for proximity tracing to work. Now, the researchers got after a while so upset about this because, in fact, it's not what their paper says, because first this paper was only a model, and this paper assumed that there was no other tracing happening. Okay, but this argument was used in many countries to say this app is ridiculous because, you know, we did a test among users, and in most countries, between 20 to 50% of the users are thinking of installing the app, and you need 60% to be effective. And then they quoted this study, which actually didn't say that. But so even today in Parliament, there is every week still questions asked in which references are made to this 60%, and why don't we stop the app because we don't get 60%. I think something very important is also that we found out that actually speed is very important. So contact tracing, if it works optimally, you reach people within 1 to 2 days, but especially if you have a wave and the number of cases goes up, then it can take 3, 4, 5 days before you reach somebody. So in principle, with the app, you can reach everybody within 12 to 16 hours. So, and this independent of the volume, so there is no problem there. The problem we have then, or we had at some places, you can no longer test people, but at least if people get warned, they can actually go in quarantine, and if they behave properly, they will actually no longer infect others. So I think that's something we didn't understand as much in advance, that if really you get a wave and a peak, then typically contact tracing either abandons or at least becomes so slow it becomes less effective, while actually the app still works perfectly. The app doesn't have a problem of upscaling up. The other problem, of course, is cost. If you look at cost efficiency, so as you will see, the impact of the app is limited. If you look at cost efficiency, the cost of the app, my estimate is that the app in Belgium has cost less than about 1 week of contact tracing, manual contact tracing. So you can't expect, of course, in this circumstances, I think it's already very good if you see the app does a substantial share of the work, even if it's 5% or 7%. If you can do this for a fraction of the costs, it can be effective. In September, a new study was published, again, based on a model, and I will not go into detail, but more or less what this shows is, this is what the curve which you have in effectiveness, this is in the x-axis you have adoption, in the y-axis you have a fraction of reduction of the pandemic. If you have only the app, and then in black you see here the curve which says what if you have manual contact tracing, and then blue says if you have the combination of the two, both manual contact tracing and the app. That's what you actually see, is that the app, even with modest adoption, actually does improve over manual contact tracing, either by being faster or by finding new contacts which were impossible to trace using manual tracing. So I will not go too much into detail in the messy part of Bluetooth. Is it good enough? So here you see some measurement data done by, I think this is particularly EPFL or ETH, by the EP3 consortium. There were many other teams doing measurements. So this is more or less what you see. The x-axis is attenuation, in the y is the distance. So of course you see this typical curve, but you also see it's very noisy. It depends on how people hold their phone. Is their phone in the pocket or is it in a handbag? What model of phone is it, and so on and so on. So based on this, some people said this can never work. Second graph shows you precision versus recall. So ideally you would like to be here, which means that you find everybody who comes close by and you don't misidentify people. So this is high precision and high recall. So in practice, what people use as a threshold is about 55 dB for 1.5 meter. that actually gives you a precision of only 55% and a recall of only 60%. Now that's only part of the story, because actually, this is for distance of 1.5 meters, but if you look at 2 meters, so if you also accept that you want to find people within 2 meters, you actually find your precision goes up and your recall doesn't decrease too much. And of course, in practice, we know that transmission is based on aerosols, and so aerosols don't magically stop at 1.5 meters, right? Of course. So in practice, it turns out that it's a very messy thing, but the results are still quite reasonable. And of course, there is some complex algorithm being used where we have 2 thresholds. Typically, people set them at 55 and 62.5 dB. And it turns out that those give reasonable results. Here is some results of a German study where they did experiments with 139 phones. And so you see that exposed phones, so if somebody was actually infectious, the app detected in 19 cases exposure, in 91 cases it was correct, over positive or negative. In 8 cases you got here an error, and 21 cases you got there an error. So if you look at the numbers, 70% precision, 47% recall, and 79% accuracy. Now you can say this is really terrible. Is this good enough to roll this out? And so at first sight, and many critics say this is not good enough. It turns out in practice it is good enough. Also, if you look at the attack rate. So what is the attack rate? The attack rate says, assume you had a high-risk contact. So high-risk contact is within 1.5 meters for 15 minutes or more. So if you have such a contact with an infected person, in fact, the probability of being infected is 15%. So if you imagine you could do perfect manual contact tracing, then you would still, more or less, for 7 people, you're quarantined, only 1 person will actually be positive. So you see there is a huge error margin anyway. And so even if this algorithm is only accurate 70, 80%, this is actually good enough. Of course, you will always miss people and you will always quarantine people who you don't have to, but even in manual contact tracing is the same. So it's a noisy thing. And so this obsession that we have to identify exactly those contacts, not what you have to do. You have to do something that is good enough that actually can reduce, identify new cases, people who quarantine, and you can stop the spread. So then I want to show you some numbers of Coronalert. So what you see here is number of downloads. So the beginning is 29th of September. In blue is Android. In orange is iOS. I expect those to pick up a bit because a week ago, in fact, the app became available for iOS 12.5, so the famous iPhone 6. Total number of downloads is slowly going to 2.5 million. Number of active users, though, is smaller. We don't know for sure how many there are. And as you see, we don't have all the data yet, but our estimate is something between 1.2 and 1.3 million active users. We identify those based on dummy traffic. But there is actually, this is quite tricky to do because in an ideal world, of course, all the phones send dummy traffic. But there is still a major problem on some Android phones in particular, where if you don't use the app for a while, the operating system actually puts the app to sleep. And so these apps will also not generate dummy traffic, so we don't know whether they may be still used during the day or not sometimes, and so on. So it's actually not so easy to detect this or to find out. And of course, it is a problem also for the owners, because if your app goes to sleep, it stops working. And it has to do with the fact that some manufacturers have a very aggressive power management, and then they don't whitelist this app Coronalert as being an exception. This is a problem that is globally happening with all the apps based on this protocol. And of course, the vendors are being put under pressure, the Samsungs and the Xiaomis and the Huaweis, to actually solve this problem. And they do slowly, but only for newer phones. For older phones, you can still see that some of the phones go asleep. And of course, it's very hard to detect this because we don't have telemetry. But so this explains in part why I think the number of active phones is so low. And we see the similar numbers in other countries who do have more telemetry, who have more similar measurements. So it's about 55% of the people at this moment actually having an active device. Also have to say that in Belgium, there was almost no budget spent on media. There was some budget spent in September and October. Since then, there has been almost no advertising. And we have been talking to the government to do a new effort as soon as the lockdown will be loosened a bit, to actually encourage the users again, and hopefully people will reactivate their app and we can get this back up to 60 to 70%. So here you see the total number of tests being done, and then how many end up in the app. So it's not so surprising. So this is the test in the app is the gray curve. And so it's about 10 to 11%, which is more or less what we have in terms of adoption, although of course the downloads is about 20%. But that's another way we can actually estimate the number of active phones. Now this makes it a bit more difficult, this high curve here, to see the rest. So I leave out the orange curve on the next slide. What you see here is the number of index cases. So you see here the second wave in October. What you see here in orange is the number of tests in the app. So it still keeps going up, which means that we seem to get better at capturing tests in the app, but linking people up to the tests. There's still a big problem there with the medical personnel that doesn't see this as a high priority. Luckily, most of those tests, 95%, are negative, and the yellow ones are the positive ones. What you see here is which fraction of tests end up in the app. So this is the blue curve. So you see we're about at 10 to 12%. I think if we could do more effort in terms of media, also still talk more to doctors, we're still working on this. This could be increased probably to something like 15%. Number of index cases, we actually do better. So it seems that somehow this is not completely explainable, but we get about 13% of index cases in the app. And then I think the curve, which was to me more surprising, is which fraction of people, once they get actually a warning, actually share their keys with others. So in most other countries, you have to call a number, and then you get hopefully some advice, and then you get the 6 to 8 digit code, and they see that about 40 to 60% of the people actually do this. Now in Belgium, nobody calls you. There is no number to call to help. You just have to actually push a button and share your data. It's a bit of an awkward mechanism because Google and Apple insist that they also ask for authorization. So this is one of the things we wish we could abolish, but so you have to twice be sure you want to do this. And so we see that only about 35% of people actually do this. So here, this data is an anomaly because of some problems. We had some problems at the Belgian side connecting with the EU server. There were some bugs that created some problems, some delay in results getting forwarded. And then when these problems were solved, Google had a problem globally with their app. They made a configuration problem, and then the app started working for several days as well. So this peak, you can more or less, this is created by problems with the office, with the back office, which then later were recovered. So more or less, we're only at 35%. And so we're going to do some work now to try to improve this, on the one hand at the UI, on the other hand, trying to talk to users and find out what we can do and make it easier to do this. So one of the hypotheses we have is that, of course, some people are still shocked when they get a diagnosis. So they get a positive result for the first time in their app. And maybe they have other worries than warning other people. They just get, they just are kind of in a state of shock or they're surprised, and they actually look at the test and they go do something else. They call whatever, one of their friends. And so they actually no longer revisit the app. So that's something hypothesis we have as well. So, but this is, I would say, a disappointment or surprise. I hope it would be easier in Belgium because you don't have to call a number and wait until they want to deal with you. On the other hand, of course, in the other countries, people get some support when they get a positive test result. And here, this is kind of independent from the app. And the government is not so keen to invest in offering support with people who get positive warnings. I guess they have other priorities. What you see here is number of keys being uploaded. So this is the gray curve. So you see this is about 12,000 per week. This was the second wave. This here is again an artifact as a consequence of the bug and some keys being uploaded multiple times. So at this moment, we are about 2,000 to 4,000 keys per week being uploaded. And I think I'll skip those graphs and I'll skip the details. You can have the slides. I just want to wrap up. So I think it's kind of amazing that we managed to roll out in quite a short time, at least if you look at the Swiss and German case. It's like more or less between getting together and making a design, rolling something out that in the end has been usable in something like, at this moment it's being used by, well, I think that my estimate is about 100 million downloads globally, 50 to 60 million users. That actually is privacy by design. So we can actually show that this design cannot be abused by intelligence forces, by police, to actually get information they shouldn't get. It's very important to work on public acceptance, because you see this in some countries where there is no public acceptance because of earlier problems and so on, then they never get an acceptance or install rate above 10%, and then definitely the app will not work. So I got to talk a lot with legal people, and they're very concerned about privacy, as we privacy engineers tend to be. But then the lawyers tell me, this app is an intervention that to some extent is privacy violating, because you get some information. So you should prove it's effective. But of course, the more privacy friendly we make it, the harder it is to prove it's effective. So you get a very interesting contradiction that the lawyers actually almost insist that you make your app less privacy friendly, because then you can prove it's effective. And we say, well, there is some indirect evidence that it's effective. And unfortunately, I made my slide yesterday evening, and of course, this is Murphy's Law. This morning, the UK published a study demonstrating the impact of the NHS COVID-19 app. They have some telemetry in their app, and they claim that they managed to warn about 500,000 or 600,000 people with their app, which also went live in the same time as Coronalert. They also claim that per percentage of uptake, that they can reduce the number of infections between 0.8 and 2%. So which actually, I think this is the first large-scale study which they have been able to do because they have some telemetry. There is many details to be dealt with. There is many wars to be fought. And so in a sense, it's not like only technology, it's also policy, advertisement, many technical glitches. And I think one lesson I've learned, and if there is lawyers in the audience, I definitely want to give them that advice. So more or less, the privacy authorities said, well, we want to know exactly what's going to happen because we want to inform people. And then so you write more or less what you're going to do. And then I say, then another legal counsel, I don't understand this. Can you explain this again? Can you explain this better? And so in the end, what you end up is with legal documents, laws, that describe every fine detail of a protocol. Because they say we want to have certainty about what's happening. And now the problem is that you can't change the protocol anymore. Because it's written in the law, and changing a law takes a year or more. So actually, I think this is a plea to not do this, and to have more trust in audit, and say we should actually evaluate what's being implemented and give feedback on that, rather than actually insist that the citizen can read every fine detail in the law, and then you can no longer change it, because that's not how these kind of systems should be designed. So I want to stop here. Thank you for your attention. Of course, I want to thank also everybody in the team who helped this, a very big DPQT team, and also the very big national team. I'm happy to still take some questions if there is time left. Thank you.